Did you know that nearly half of men over the age of 65 will receive a PSA test at some point, yet many of them will never truly benefit from it? Here's the shocking part. While the test is meant to detect prostate cancer early, it often creates more confusion, anxiety, and unnecessary treatments than solutions. So let me ask you this. If a simple blood test could change your life, but not always for the better, wouldn't you want to know the truth before rolling up your sleeve? That's exactly what we're diving into today. This video is all about PSA tests after 65, the hidden truths that most doctors rarely discuss openly. By the end of our time together, you'll understand what the PSA test really measures and why it gets so confusing after 65, the risks of taking the test too often, including unnecessary biopsies and treatments, smarter, healthier alternatives for protecting prostate health in your senior years. This isn't about fear, it's about clarity, empowerment, and peace of mind. And as someone who deeply values helping older adults live healthier, happier lives, I promise to keep everything clear, practical, and easy to follow. So, whether you're 65, 70, or even older, or you have a loved one in that stage of life, stay with me. Let's uncover the hidden truths behind PSA testing together. Point 1. Why PSA tests become so confusing after 65. When most men first hear about PSA tests, the idea sounds comforting. A simple blood test that can catch prostate cancer early? Who wouldn't want that? But here's where reality becomes tricky. After 65, the PSA test often raises more questions than answers. What the PSA test really measures? Let's break it down simply. PSA stands for prostate-specific antigen. It's a protein made by the prostate gland, and every man has some PSA in his bloodstream. The idea is that if your PSA level rises above a certain normal threshold, doctors might suspect prostate cancer. Sounds logical, right? But here's the catch. PSA levels rise for many reasons that have nothing to do with cancer. If your prostate is enlarged, and that happens naturally in older age, PSA goes up. If you've had a urinary infection or inflammation, PSA can spike. Even a recent medical procedure, or sometimes just riding a bike, can affect PSA numbers. So when the result comes back elevated, it doesn't necessarily mean cancer. It just means something is happening in the prostate, and that something could be completely harmless. Why this matters more. After 65. By the time men reach their mid-60s and beyond, the prostate is almost always larger than it was at age 40 or 50. And with that enlargement comes higher PSA levels, even in completely healthy men. Think about grey hair for a moment. If we used hair color as a test for illness, then almost every man and woman over 65 would look sick, because most of us naturally have grey or white hair by then. But we know grey hair simply means time is passing. PSA works in a similar way. For seniors, higher PSA doesn't always mean disease. It often just means you've lived long enough to see that number rise. A real-life example. Let's take George, age 68. He's active, enjoys gardening, takes long walks with his wife, and feels perfectly fine. During a routine checkup, his doctor suggests a PSA test. George agrees. It sounds harmless enough. A week later, the doctor calls. Your PSA is a little high. George's heart sinks. He spends nights lying awake, worrying that he has cancer. His doctor recommends a biopsy, just to be safe. George goes through the procedure, uncomfortable, stressful, and invasive. After weeks of waiting, the results show no cancer at all. George feels relief, but also frustration. He endured fear, stress, and a medical procedure he may never have needed, all because of one test result. Sadly, George's story is not unusual. This cycle of testing, anxiety, more testing, and then finding nothing dangerous is common for seniors. Why doctors keep recommending the test? You might wonder, if PSA is so confusing after 65, why do doctors still suggest it? There are two main reasons. Habit. For decades, PSA testing was promoted as the gold standard for catching prostate cancer early. Many doctors are used to ordering it without question. The fear, both doctors and patients fear missing cancer. The idea of doing nothing feels risky, so testing seems safer, even when evidence shows it may not be. But in recent years, medical organizations have re-examined the evidence. The U.S. Preventive Services Task Force now advises against routine PSA screening for men over 70 and suggests careful discussion for men between 65 and 70. Why? Because the potential harms, false alarms, unnecessary biopsies, and overtreatment often outweigh the benefits. A practical comparison. Let's say we have two men, both 70 years old, both with a PSA level of 5.0. Man A has no symptoms, no family history of prostate cancer, and feels healthy. Man B has trouble urinating, pain, and blood in his urine. The same number, 5.0, means two very different things. For man A, it might just be normal enlargement. For man B, it could signal a more serious issue. The key point: PSA tests after 65 need context. A number alone doesn't tell the full story. Key takeaway from point 1. So here's what we've learned. PSA tests after 65 are not black and white. Numbers rise with age, results can be misleading, and acting on them too quickly can create unnecessary fear. Instead of seeing PSA as a yes or no answer, think of it as one piece of a larger puzzle. Symptoms, medical history, and overall well-being matter just as much, if not more, than a single test result. But confusion is only the beginning. The real concern comes when these confusing results lead to more tests, more procedures, and even treatments that may not be needed at all. In the next section, we'll uncover the hidden risks of over-testing. What happens when PSA screening becomes a slippery slope for men after 65? Point 2. The hidden risks of too many PSA tests after 65. Now that we've seen how confusing PSA tests can become after 65, let's go one step deeper, because the real danger isn't just the confusion, it's what happens next. When men keep repeating PSA tests year after year, they often end up on a path filled with risks they never expected. Risk 1. False alarms and anxiety. Imagine being told over and over, "Your PSA looks a little high, let's check it again." Each time your heart skips a beat. Even if you feel perfectly healthy, that tiny piece of news sits in your mind like a ticking clock. For many seniors, this constant worry becomes worse than any physical symptom. Studies show that older men with slightly elevated PSA often experience long-term stress, sleepless nights, and even depression, simply because they believe something dangerous might be growing inside them. And here's the painful truth. Most of those worries turn out to be unnecessary. Many of these alarms are false. The PSA was high, yes, but not because of cancer. Risk 2. Unnecessary biopsies. The next step after an elevated PSA is usually a biopsy. That means inserting needles into the prostate to take tissue samples. It sounds small, but for seniors, it's not always safe. Biopsies can cause bleeding and infection. Some men need hospitalization after complications. Even when everything goes smoothly, the procedure is painful and stressful. And remember, many of those biopsies reveal nothing harmful at all, which means older men are going through invasive procedures for problems that never existed in the first place. Risk 3. Overtreatment. Here's where things get even more serious. Let's say a biopsy does find a small cancer. In many men over 65, that cancer is so slow-growing it would never cause trouble in their lifetime. But the moment the word cancer appears in a report, fear takes over. Some men rush into surgery to remove the prostate. Others undergo radiation therapy. These treatments carry risks of incontinence, erectile dysfunction, fatigue, and more. So a man who felt perfectly fine at age 68 might end up with lifelong side effects, all because of a cancer that may never have harmed him. This is what experts call overtreatment. It's treating something that didn't really need treatment at all, and overtreatment is one of the biggest risks of relying on PSA tests after 65. Risk 4. The domino effect on quality of life. Each of these risks, false alarms, biopsies, overtreatment, creates a domino effect. One test leads to another, which leads to another. And before long, a man's golden years are filled with doctor visits, hospital stays, and side effects, instead of the freedom and peace he deserves. Let's return to George, the man we met earlier. After his first elevated PSA, he had a biopsy. The biopsy was negative, but his doctor wanted to keep an eye on it. So George repeated the test every 6 months. Each time he felt nervous. By age 70, George had gone through 3 biopsies, several weeks of unnecessary stress, and countless hours sitting in waiting rooms. None of it changed the fact that he was healthy, but it robbed him of time and peace of mind. Why this matters for seniors. At age 65 and beyond, time becomes even more valuable. Every moment spent worrying in a doctor's office is a moment not spent enjoying family dinners, playing with grandchildren, or traveling with a partner. That's why it's so important to recognize more testing is not always better. For seniors, too many PSA tests can actually make life worse, not better. So if too much testing is risky, what's the smarter path forward? How can older men protect their health without falling into the trap of endless PSA testing? That's what we'll cover in the next section. Smarter alternatives and healthier approaches to prostate health after 65. Point 3. Smarter alternatives to PSA tests after 65. When men hear about the risks of PSA testing, some feel stuck. They think, if I don't do the test, how will I know if I'm safe? That's a fair concern. The goal isn't to ignore prostate health, it's to approach it with wisdom and balance. Here are smarter, more thoughtful strategies for protecting yourself after 65. Alternative 1. Shared decision-making. Instead of saying yes or no to every PSA test, have a real conversation with your doctor. This approach is called shared decision-making. Ask questions like, given my age and health, how likely is it that a PSA test will help me? What are the chances this test could cause me harm? If the result is elevated, what would the next steps be? By asking these questions, you're not just a patient, you're a partner in your care. Together, you and your doctor can decide whether another PSA test truly makes sense for you. Alternative 2. Focus on symptoms, not just numbers. Instead of chasing numbers on a lab report, pay closer attention to how you actually feel. Warning signs of prostate issues include frequent urination, especially at night, weak urine stream, pain or blood when urinating. If you notice these symptoms, that's a reason to talk with your doctor. But if you feel fine, chasing after higher PSA numbers may not be necessary. This approach shifts the focus from lab results to real-life health. Alternative 3. Lifestyle choices for prostate health. Here's something powerful. Simple lifestyle habits can protect your prostate just as much, if not more, than constant testing. Nutrition. Eating more fruits, vegetables, and omega-3 rich foods may lower prostate inflammation. Exercise. Regular physical activity improves circulation and hormone balance. Avoiding smoking and limiting alcohol both reduce risk of many cancers, including prostate. These are actions within your control. They give you a sense of empowerment instead of dependence on tests. Alternative 4. Watchful waiting or active surveillance. For men who are diagnosed with a very slow-growing prostate cancer, one option is called active surveillance. That means monitoring the situation carefully over time, rather than rushing into surgery or radiation. This approach helps avoid overtreatment while still keeping a close eye on health. It's like checking in on a garden. You notice the plants, pull weeds if needed, but you don't tear everything out unless absolutely necessary. Let's meet Henry, age 72. Henry's doctor offered him another PSA test, but instead of automatically saying yes, Henry asked questions. Together they decided that unless Henry developed symptoms, he wouldn't repeat the test. Instead, Henry focused on eating better, walking daily, and spending time with his grandchildren. Years later, Henry remains healthy and grateful he avoided the stress of unnecessary tests. At its core, the smarter approach is this: don't let PSA tests control your life after 65. Instead, focus on your overall health, your quality of life, and the moments that truly matter. Testing can be helpful, but only when it's the right test at the right time for the right person. For many seniors, fewer tests and more living is the wiser choice. So far, we've uncovered the confusion of PSA tests, the risks of over-testing, and the smarter paths forward. In our final part, we'll tie everything together, recap the key points, and end with an inspiring message about living fully and healthily after 65. What we've learned about PSA tests after 65. Let's take a moment to pause and review everything we've explored so far. It's easy to get lost in numbers, medical terminology, and doctors' recommendations. But if there's one thing to remember, it's this: your health is more than a single test result. Step 1. PSA tests are not black and white. In our first section, we learned that PSA tests measure a protein in the blood produced by the prostate gland. On the surface, it seems simple. High PSA equals potential cancer. But after 65, the picture is much more complicated. PSA naturally rises as men age. Many elevated results have nothing to do with cancer. They could be caused by prostate enlargement, infection, or even recent physical activity. Acting on these numbers without context can lead to unnecessary worry, stress, and medical procedures. We use George's story to illustrate this point. A man in his late 60s who felt perfectly healthy but was sent through biopsies and anxious weeks, all for a number that didn't indicate cancer. The key takeaway here: PSA tests after 65 are just one piece of the puzzle. They are helpful when used wisely, but they do not tell the whole story. Step 2. Over-testing brings real risks. In point 2, we explored the hidden dangers of over-testing. False alarms. Repeated PSA tests can trigger unnecessary anxiety and stress, often lasting weeks or months. Unnecessary biopsies. Older men are more vulnerable to complications like bleeding and infections. Many biopsies end up showing nothing harmful. Overtreatment. Slow-growing cancers found through PSA tests often do not require immediate action. Yet fear and pressure can lead men into surgery or radiation, causing long-term side effects like urinary problems and sexual dysfunction. Quality of life. Impact. Constant testing and medical procedures take a toll on emotional well-being, time and energy, resources that could be spent enjoying life. We also discussed Robert, age 72, who chose surgery for a tiny, non-threatening cancer and ended up facing permanent side effects. His story is a cautionary tale for all men considering frequent PSA testing after 65. Step 3. Smarter approaches and alternatives. Point 3 was all about solutions. PSA testing doesn't have to be scary or harmful, it just needs to be done thoughtfully. Seniors have multiple ways to protect prostate health without unnecessary procedures. Shared decision-making. Instead of automatically following every PSA test, talk openly with your doctor. Ask questions about the risks, benefits, and likely outcomes. Together, you can make a plan that fits your health goals and lifestyle. Focus on symptoms. Pay attention to real-life indicators like difficulty urinating, weak urine stream, pain, or blood in urine. Symptoms often provide more meaningful information than lab numbers alone. Healthy lifestyle habits, exercise, balanced nutrition, stress management, and avoiding smoking or excess alcohol all support prostate health. These actions empower you, putting control of your health in your hands rather than in a lab test. watchful waiting, active surveillance. For slow-growing prostate cancers, monitoring instead of aggressive treatment can preserve quality of life while keeping an eye on potential changes. Knowing when to stop testing. Seniors over 65, and especially over 70, may not need routine PSA tests unless symptoms or risk factors are present. Recognizing this can save time, money, and mental energy. Henry's story illustrates the power of this approach. At 72, he chose not to repeat a PSA test unnecessarily, focused on healthy habits, and continued enjoying life with peace of mind. The one message to remember. If you take away just one lesson from this video, let it be this: your life is more than a test result. PSA tests after 65 can be useful, but they are not the ultimate measure of your health. Your daily habits, lifestyle choices, and thoughtful decisions matter far more than any number on a lab report. Numbers can mislead, especially with age-related changes. Overtesting can create stress, unnecessary procedures, and side effects. Smart, mindful choices preserve your well-being, independence, and joy. Let's imagine a typical week in the life of two men, both 70 years old. Man A follows the old path. He takes PSA tests every 6 months, goes through repeat biopsies, and worries constantly about every little number. His life revolves around medical appointments, phone calls from his doctor, and sleepless nights waiting for results. Man B takes a smarter approach. He discusses PSA testing with his doctor, monitors symptoms, stays active, eats well, and practices stress management. When his doctor offers a PSA test, he weighs the benefits and risks carefully, only taking it when necessary. He spends his free time playing with his grandchildren, gardening, and enjoying his hobbies. Which man is truly healthier? The answer isn't found in lab numbers. It's found in quality of life, peace of mind, and well-being. Here's how you can take control today. Subscribe to this channel. Each week, we share practical, evidence-based health advice for seniors. Subscribing ensures you'll get the latest tips for living a longer, healthier, and happier life. Share this video with friends and family. Someone you care about may be considering PSA testing without knowing the risks. Sharing this knowledge could prevent unnecessary stress, procedures, and side effects. Engage in conversation. Leave a comment below if you've had experience with PSA tests after 65. Your story may help others make informed decisions. Aging is a privilege. Every year after 65 is a gift, a chance to enjoy family, pursue passions, and live fully. Your health decisions should empower you, not control you. Remember, PSA tests are a tool, not a verdict. Use them wisely. Focus on what truly matters. Living with energy, joy, and peace of mind. Take the lessons from today's video and make choices that protect your health while preserving your quality of life. Ask questions, seek clarity, and remember that every decision is an opportunity to take care of yourself, physically, emotionally, and mentally. Let's return to Henry one last time. At 72, he made conscious decisions about PSA testing, embraced healthy lifestyle habits, and prioritized his quality of life. Today, he enjoys morning walks, cooking with his wife, and spending afternoons with his grandchildren, all without the constant anxiety of unnecessary medical interventions. His example shows us what's possible. Seniors can take control of their health, make informed choices, and still enjoy life fully.